So the first pass is good for anybody. We just really assess people's interference or obstacles to healing. And if it's relevant, then we address it. If it's not, we just move on to the next stage, wherever people are at, so that they can get the best success. Okay, so there's, and even the tests that we organize for people, it depends on your history. And some people need a lot more extensive testing, other people need some basic stuff. And so the main thing is, I think, so that's the 4 phase. We'll look at removing toxin, cellular burden, cleansing, detoxify. Then the phase 2 is the hormone phase with the low-calorie diet with supportive treatment. There are some fat-burning support treatments that we actually use with that as well. The phase 3 where you can transition off the hormone and you get some quantum cellular regeneration treatment and supportive treatment. And the phase 4 when we're looking at the maintenance long-term diet changes. Okay, so there's some people who've had, the body shaping, so the tummy just goes flat.
What time frame would you be looking at with these class here?
4 or 6 weeks.
Oh, yeah.
It's in 6 weeks. It's amazing. This lady also got her waist back. I've got lots of patients who've just dramatically got their waist back where they never had a waist before. So it is quite amazing in that way. So we might do, I said, you get pH keto to see if you're fat burning, pH testing strips. These are kind of pre and post program testing that we look at as well. So it depends. And what I'm going to suggest that we're going to do is to, everyone here, we're going to give you a free half an hour consultation with the naturopath to discuss your needs, so that you can come in and see if it's right for you. Because it's not for everybody. Some people I say it's not for you, you're not ready for it, because really there's a lot of other issues. So it's better if you get properly evaluated as to whether you qualify and whether we are the right people to help you. So you get that with our naturopath. Monique over there, she's really trained. You can stand up, Monique. I'm going to say here.
Yeah. Hiding in the back there.
Yes, yeah. So she's one of our naturopaths here, and she's very well trained in doing the fat, it's called the HCG Fat Burning program. And essentially she will take people, through that first phase and to ensure that, you cleanse and detoxify, do all the testing, everything. And then we even do people per distance. Some people live very far away, and we have lots of people who live far away who actually do it per distance. And it's a little bit differently, but people have problems. It's better if you can get to a clinic. Because when you're on a program, what do you think, the patients you've taken?
Much better face-to-face. Much better. So.
Yeah, because we can test you hands-on. It's just so much more support, and you get the compositional analysis done. Your fat and muscle mass every time, and your weight and your measurement. You see things working. It's very, very motivating. So that's the kind of things that we can look at for you, and we can. We'll have to have the code.
Are you saying that some people it might not work for, or that you might not think are suitable? Or
some people.
Too many problems? Or?
It's not more or less that's not suitable for. Well, first of all, if they're not committed, I don't bother.
No.
So yes, I would say that. There is actually no real contraindications to it, even if you're on medication, especially because I can supervise that. Someone's on medication, they're hypertensive or diabetic, it's actually really good for diabetes. But I supervise that through, like if you have thyroid medication, it doesn't work quite as well because you've already been artificially revved up, okay, but it still works. It works well. It's just that what we do is we say, look, let's get healthy first before you do it. And people, as I said, often lose weight anyway, but more or less they feel energetic and healthy. And that's the main thing that is important. That's the priority I want. I don't want someone quick fix, burn and churn and slash and burn in and out and put it all back.
Say 3 months to go through that first phase.
Yeah.
If you do have sort of quite a few problems.
Absolutely.
It could take at least 3 months to go through that getting well stage.
Yes.
And moving on to the second stage.
Yes.
So you do have people that take that long to
Absolutely. Some people we take even longer.
Yeah, it was just when you said it's sort of like 4 to 6 weeks or something.
No, that's only the hormone phase. That's the phase 2 when they do the 4 to 6 weeks.
Right. But
so
that first phase could take shorter or longer?
Some people take 12 months.
Yeah.
Most people don't. I mean, most people only take a few months, but some people, if they've got a lot of medical condition and we've got to really work on them, I want them to be reasonably healthy before they do the hormone phase.
As you say, that committed is...
Because if they can't even do that, I mean, how are you going to go on a 500 calorie diet?
Like that, yeah.
Exactly. And also that diet, that's the part where you lose the body shaping effect. And that's when people, I want that body shape. But they do still get that to some extent on the first phase anyway. But it's just not so rapid as that second phase. And then yes.
Sorry.